All right. Hello, I'm Matt, and the healthcare professional that I decided to meet with and interview was actually a family friend, Nancy Edwards. She is a nurse in the oncology department of Johns Hopkins, where she has been there for 20 years now. And the big reason I chose to interview her was because I wanted a little feedback from someone that works in a large hospital setting versus a smaller, because as far as my business degree goes, I'm pretty interested in healthcare management on a larger setting. So I think interviewing someone with that kind of background would give me a little bit more knowledge into what I'm looking forward to and some things I may like and not like. So a little background about her. She has a bachelor's degree from the University of Maryland in nursing school. Um, After graduation, she worked as an RN at a smaller hospital in Carroll County for a couple years before she applied for the nursing job at Johns Hopkins. As far as certifications go, she is OCN certified, which is Oncology Certified Nurse. She got that before accepting the job, so that is a requirement to work in that unit. She works in the patient oncology unit there, and she deals with the treatment of cancer and the administration of chemotherapy. So she's dealing with pretty sick patients day in and day out. So she said that was something that can get pretty tough for her. And as far as why she chose to be in this medical field, she said that helping those in need was something that she was interested and passionate about ever since a young age. She always wanted to help people that were in need, and especially those very sick of cancer, is important to her now. She did discuss a lot of things that she does not like about working at Johns Hopkins and in her department. She's been there for 20 years, and she had a good amount of complaints and a few good things to say, but a couple of the big complaints were that she didn't like that her nursing job, she was doing the job of other departments, such as the ancillary staff. Also, her coworkers were sometimes not doing the work they were supposed to be doing, and that made the whole unit suffer because she would have to make up for their lack of work. So a couple things that she didn't like about that. A few things that she did like. She liked how well ran the hospital was. A large setting, it can get a little difficult. She did have problems with administration and some of their decisions, but on a larger scale, she thinks that the hospital has been running pretty effectively for the past 20 years. The mission of Johns Hopkins Medicine is to improve health of the community, the world, by setting the standard of excellence in medical education, research, and clinical care. And as far as teams in Johns Hopkins Hospital are set up, she said they're set up by unit, by department, and then by department leads. And she said that actually does help them a lot into understanding what's going on around the hospital and really getting everybody on the same page. She says challenges that she faces every day are having each of the people in her department and her unit do their jobs. Like I said earlier, if one person is slacking off, it affects the whole department. So another thing she said was in the 20 years that she's been working there, she's seen dozens of nurses come and go pretty quickly because they couldn't handle the work and the patient care that Johns Hopkins holds their nurses and doctors to. So she says she's seen a lot of people come and go in her years in the oncology department. And so in the oncology department, they work with people who are very sick, very ill of cancer, and wanting the best care for these patients is something that really motivates her and makes her strive for better care each and every time. And change in the organization is usually mandated by the administrators, which she claims sometimes don't really know what's going on by the bedside. I know in healthcare management, a lot of the upper level managers sometimes haven't worked in hospitals as a nurse or as a doctor, so really they expect things to be running one way, but sometimes they don't know what's going on in the hospital rooms and by the bedside, so they kind of make unrealistic goals for these employees. And as far as change goes, it's usually administrated by the higher level employees. She said as a nurse she doesn't really get much insight on it, and if she is asked for insight, the decision usually has been made, so that's kind of a slap in the face, she says, as decision making goes. But she'd like to see a little bit more incentive on insight for the departments and for the hospital as well. As far as effective change management goes, she said that she appreciates when administration asks for her input, and she would like a lot more input on her unit, at least, if not a little bit more of the department overall. And when asked about what the frontline staff is being utilized as a resource, her response included that customer satisfaction is very important at the Johns Hopkins Hospital. They pride themselves on the customer satisfaction, and surveys are constantly being conducted like many other hospitals, and the entire staff is very well versed on that, and they hold that pretty close to their heart, as they want the highest level of care, and they want to keep that Johns Hopkins name as one of the best hospitals in the U.S. and in the world as well. If a patient or family comes and writes a survey and they aren't happy, those surveys go to the patient relations department, and they're closely analyzed and observed and figured out how they can do better next time and each and every time. If someone is not getting the quality of care they think they should be. As far as high performance goes, Mrs. Edwards says that they have adopted a hospital-wide evaluation system called Success Factors, and this focuses on goal setting, personal, professional, and unit-based goals, where they can sit down and figure out what they need to do and how they're going to do that. She said, management meets on a biannual basis, and compensation is related to the level of performance. So if nurses are underperforming, that can sometimes lead to a salary cut or a pay cut, or even being fired from the hospital. So she says those goals and those meetings with the staff are actually very important, and they have to prepare for those as well. As far as the healthcare industry goes, she, as many others, know that it's constantly changing, and right now the healthcare industry that she's been around is very patient and family oriented and driven. So really they're focused on delivering the best quality of care for these patients day in and day out. And as far as the next 5 years go, she's a little worried about where it's going to go because of the change of the president. She's not a fan of the Obamacare Act, but she's a little scared about what the changes that President-elect Trump might make. So as far as the next 5 years, she's uncertain, but she's not totally scared. So. And as far as the all-around interview goes, I did learn a lot about what goes on in the external and internal environments of a large hospital like Johns Hopkins. She was very insightful, and she's been there for 20 years, so she has a lot of experience working with this hospital for the past 20 years. And seeing a lot of the management issues that she has, I think that's definitely a job that's been growing, and that's something that I would try to pride myself on and make sure that all the patients are getting the best quality of care. And as far as if she really enjoys her job as much as she used to, she claims the first 10 years in nursing she was excited. She learned a lot, but the past 10 years she's been really getting worn out. A lot of her patients pass away after like a few months of care, and she gets to connect with them, and that's something that she says is definitely the hardest part, to come home and know that those families are suffering, and that she tried her best to save them. So as an emotional aspect, that is something that is tough for a nurse and most healthcare professionals. So all in all, I learned a lot from her as a very successful professional at the Johns Hopkins Hospital, which is one of the elite hospitals. So I'm glad I got to interview someone that level of care, and overall it was a good experience to interview her. So.